Welcome to this Zoom presentation. It's an update from pandemic to progress about the CDCA in Nicaragua. And we're glad to have you with us by Zoom since we cannot be with you in person. While COVID-19 consumes the news and people's thoughts, the Center for Development in Central America is also dealing with the virus, while trying to serve Nicaraguans, also protect our staff, our patients, and others, as well as continuing to work in the areas that our organization has chosen to focus on: sustainable agriculture, sustainable economic development, healthcare, and education. With COVID, it is easy to be overwhelmed with this one health issue, but as our project's leaders and the co-ops that we work with have told us, COVID will be with us for a long time. We have to move from pandemic to progress. It is time to protect everyone the best we can and get on with the work. Who are we? We're a small organization. We, the Center for Development in Central America, have been in Nicaragua for over 26 years now as the Nicaraguan project of the 501c3 nonprofit, the Jubilee House Community, Inc., who have been working with the poor first in the U.S. and now here for more than 40 years. So how did we respond to the pandemic when it began to show up in Nicaragua? Paying close attention in the spring, while opting to suspend our educational activities at Casa Ben Linder until they could be held in safety, we moved quickly to add protective policies at the clinic. Then, confirmed cases in Nicaragua spiked. We made the difficult decision to close our clinic for June. We sent staff home with their full pay, while those of us who could work from home continued working, doing financial reports and paying bills and payroll online, while making phone calls and attending conference calls, holding office staff meetings outside with masks and social distancing. Even though we're no longer able to host international volunteers because of COVID-19 travel restrictions, and with few guests staying at Casa Ben Linder, we have continued educating people around the world to the burdens Nicaraguans have to carry due to poverty, including Zoom presentations like this one, blogs that are published at least weekly, social media posts posted almost daily, newsletters like the one published online and printed last month in September. Returning to work on the 1st of July, we worked hard to move from pandemic to progress. We've put stringent policies into place to protect the staff. All staff must wash their hands at stations we have set up in front of all our buildings' entryways, and we all have to wear masks. Most are cloth and sewn to our specifications. People coming to meet with our staff have to meet outside in an area we've set up, nicknamed the Pandemic Pavilion. At the health clinic, the policies are even more stringent. Not only do our healthcare providers have to wear masks, but they also have to wear face shields and gowns as well as hair coverings. The patients are checked in outside under an awning before seeing one of our 3 doctors. We are being safe, but we must move from pandemic to progress. Outfitting everyone has been expensive and has been a serious hit to our budget. But here's what the Nueva Vida Clinic is providing and how you can help. A pediatrician who does a great deal of asthma treatment, especially with children. A physician who focuses on our patients with chronic conditions. A radiologist who also sees patients, as well as doing ultrasounds. We're seeing pregnant women again. The support group has not yet begun to meet. Rooms are disinfected, while providers change their washable PPEs. Patients with COVID symptoms are sent to be tested at a government-run clinic, the only place tests are available. It sounds a little excessive, doesn't it? But not when 3 of our Nicaraguan co-workers have recovered from confirmed cases of COVID out of our total of 23, and 1 has died. We lost Yesenia Castillo, our health promoter, to COVID in July. Her death has left a hole in our hearts. She had pre-existing conditions and was hospitalized. Her body went straight from the hospital to the grave, with few family members able to attend at graveside. Many of our staff, as well as patients, do have pre-existing conditions, which means the clinic staff must be garbed, looking like they are ready for aliens. And it leaves our construction fumigating staff grumpy because they also have to wear masks. Those of us in our late 60s and 70s are self-isolating and working from home. Like me, presenting this from home with Becca in the office. And being confined for 7 months now leaves us fairly grouchy as well. Mike and Becca are in contact with CoProXNIC, the Organic Agricultural Cooperative, by phone or meetings outside with masks. Sitting and talking on the phone to buyers, shippers, etc., all the time trying to get them better financing while dealing with the ins and outs of management, especially when English is needed. Agriculture goes on despite the pandemic. The first crop of organic sesame in this rainy season has been good. The second crop is planted and growing. The sesame plant is running with strict health precautions put in place for the safety of the workers and the product. CoProXNIC and we have managed to locate a better processor for organic peanuts, which took a lot of effort and was more frustrating because of having to work from home. But we are progressing, aiding the cooperative through our shared risk investment VITA fund, helping to keep value in Nicaragua, which is good for the growers, the buyers, and these economic efforts also provide jobs. Coffee is growing well, we are told. That harvest will begin in November. Farmer Shares, a CDCA project, is selling the organic coffee grown at a small coffee cooperative located on the top of a remote Nicaraguan mountain. Coffee is tasty and helps this cooperative to stay afloat. So if you drink coffee, this is one way you can help. Buy from Farmer Shares. Now, we as a society have recognized that we will have to live with the COVID virus for the foreseeable future, and so need longer range planning. For example, with help from a donated bleach making system, using water, salt, and electricity, our disinfecting costs are now lowered. The clinic staff also packages up monthly chronic care medicines for delivery to all our patients with pre-existing conditions. Family members come outside and receive the medicines for their loved ones, trying to protect those at greater risk. Our lab sees patients in the morning and reports the results to the doctors for targeted treatments. Our dental care clinic is doing limited dental care. Dental staff everywhere are at an extremely high risk. The therapist keeps social distance from her clients. She sees adult children and has activities for the children. We are offering non-essential services on specific days and in areas only open to healthy patients in order to decrease virus transmission. For services such as scanning, including birth control plans and renewals for the women who received them originally. PAPs to test for cervical cancer, ultrasounds, and EKGs, as well as eye vision tests, corrective lenses. The eating room has been getting finished with our construction team maintaining social distancing, and just recently, staff held 2 training sessions for our health promoters on identifying dental emergencies. We're exploring ways to continue, at least, educating our 30 lay health promoters. We are on staff to continue Yesenia's invaluable work. Progress also means that the space which now meets national required radiology specs is finally ready, and the donated used X-ray equipment can now be cleaned and tested. With other help, the clinic is moving forward toward implementing a digital medical record-keeping system that can be accessed offline during remote community visits, moving us away from so much paper use. The initial 6-month costs for startup technical design support and training have been donated. Exciting progress. We're scrounging for funding to purchase the needed tablets to fully implement the system in all areas of clinic services. Though the CDCA closed for a month, Nicaragua as a nation has not closed, except for restrictions in international air travel imposed by the airlines, but instead implemented an enormous COVID-19 education campaign. In a country of not quite 7 million people, early this year, health workers distributed COVID prevention and symptom information to even the remotest areas, reaching 4.5 million in a country of just under 7 million. In contrast to what you have probably been hearing, if anything, Nicaragua's free public health system acted to build on the infrastructure development already in process, preparing new hospitals, the cancer treatment centers, the new public clinics to be proactively ready for the pandemic, preparing ventilators where mothers at risk can go and stay until they give birth. All the long-term investments that mean progress in healthcare, ramped up to address the virus and create a healthier, more resilient population. Even taking into account that every country has a different way of testing and counting COVID statistics and the unreliability of pandemic numbers globally, Nicaragua has done much better than its neighbors, as you can see in this comparison of the number of cases per capita. Here in Nicaragua, the percentage of active cases, new cases, and deaths has been steadily decreasing since early June, with weekly announcements provided by MIDSA, the National Health Department. Social distancing and masks are required in government offices and businesses, and most market vendors wear masks, although many of the shoppers do not. Yet, because folk here survive day to day and must buy and sell fresh food daily, the government and mayor's offices are disinfecting public places at night. Our local Rotary Club has worked to provide public hand washing stations. In a country without financial resources, the importance of prevention safety measures is understood. Even the enormous annual gathering this summer on the 19th of July, with 500,000 usually in attendance, was instead celebrated virtually and in homes. Public schools have not closed, although for those who can access them, classes have been offered through TV channels, the radio, and online. With more than 1.5 million school-age children receiving a free hot meal daily as their main source of nutrition, schools must stay open. Being flexible with attendance, maintaining spacing, mask wearing, and hand washing for students who attend, and teachers checking in with students at home all help students to not fall behind. Just as COVID-19 is not the only fear-producing topic in your lives, as you follow fires and erratic weather patterns, protests and violence nationally and around the world, and despair at signs of election interference from Russia, China, and within, so Nicaragua and the poor with whom we work are also aware of other issues. Will crops grow? Will there be hurricanes and flooding? Will arbitrary sanctions and trade laws strangle progress? And with news of a document just leaked recently from the U.S. Embassy outlining a U.S. strategy called RAIN to destabilize the current Nicaraguan government and interfere in Nicaragua's 2021 elections, will this democracy be allowed its sovereignty? Life goes on in this time of pandemic. The Nicaraguan government and our neighbors are doing their best, and so is the CDCA. But as many of you know, we cannot do this alone. To truly progress in our work with the poor, as has always been true, we need your help. Please help. You can help progress continue. Together we can bring hope in the midst of pandemic. Our web address is at the bottom of the screen, and snapping the scan code on your phone will take you to our donation page. We need you. Please help. Thank you. Are there any questions?